Hi there, Emma Barry from Good Soul Hunting. Before you inhale this episode, make sure you hit the like button, subscribe, and ring the notification bell. Good Soul Hunting is a boutique search agency in fitness, health, and wellness. We place executives in marketing, sales, and operations roles. Over the last few months, we've seen the mass exodus of brand CMOs in exchange for performance CMOs and growth marketers, contributors who drive the numbers and are enabled by digital marketing. These are the new table stakes. These are the new rules, and you need to learn to play by them. As you consider your next career move, whether it be within your existing business or the next brave move to greener pastures, one thing is for sure, digital will be there, underpinning your efforts, learning and optimizing, scaling your impact. Whether the digital acceleration of your sector has been 5 or 10 years, or maybe it lags behind some of the more progressive industries like retail and banking by maybe 20 years, it will play a crucial role in your work life. So keep up with developments, retrain, deepen your study, and mindfully move in the direction so you are fluent in the new and enhanced ways. Of course, digital transformations were underway pre-pandemic, albeit some sectors shifting at a glacial pace. Fitness, healthcare, and wellness are relatively late bloomers, but it's easy to understand why. Traditionally, working out, a doctor's appointment, a massage at the spa, the focus is very much centered around a personalized face-to-face interaction. And this paradigm is hard to break. We really don't like change. We do, however, tend to tolerate and adapt to big change when the environment demands it. A war, a recession, a natural disaster, a pandemic. Our pandemic took digitization from an option to a necessity, a kind of forced adoption. Those businesses slow to react have paid dearly, if they're even around anymore. Many health and fitness clubs dragged their feet and then watched their personal trainers, followed by their members, march out the door to their screens, into the park and onto the garage. Healthcare, telehealth, virtual solutions supported the same shift, with doctors and other medical practitioners adopting digital solutions to see, monitor, diagnose, and attend to their patients. The paper trail in health and fitness has gone from manual data collection, clipboards, and written doctors' signatures to central databases and auto-filling electronic solutions. Wearable tech, fitness trackers, nutrition apps, mental health and mindfulness solutions, sleep and recovery aids, stress markers, along with deeper diagnostics and self-testing for health metrics, bring us closer to real-time self-management to help us eat, move, and decision-make with information and confidence, all made possible by affordable, consumable tech. Now, we are seeing the emergence of digital-based but person-centered healthcare systems that make it possible to deliver a more holistic approach, which centers on the needs of the patient and their support structure. Systems which take a longitudinal and a preventative view of health, wellness, and social equity, rather than just being the ambulance at the bottom of the hill. Now, one of the most important reports just recently was published by the British industry body UK Active, the Digital Futures Report, based on 3-month consultations with public and private operators, 44 organisations, more than 1,300 facilities, and gives us a really comprehensive look at the status of operators in developed markets. The main numbers: 55% of businesses had digital maturity and effectiveness, and the index described this as digital experimental level, typically meaning that operators are making great strides but missing the investment, goal alignment, and rapid advances to yield a strong performance. More concerning numbers were the approximately 30% of operators with no strategy, 84% with strategies that are out of date, not ambitious enough, or not supported by an achievable roadmap. The report pitched the case for accelerating digital strategies and skills at all levels, and that our journey has really just begun. Last month, European boutique chain Tribe was the first facility to jump into the metaverse when it partnered with Olivex to launch in the sandbox. They joined German sports giant Adidas on the blockchain-based platform. Tribe describes a forward-thinking play. Now, in healthcare, we're seeing lots of things. AR and VR being used to train simulations for surgeons and student doctors, like at Case Western Reserve University, where the Microsoft HoloLens is assisting with the study of anatomy via HoloAnatomy app. 3D printing is transforming prosthetics, while robotics has been hailed as one of the most exciting and fastest growing fields of healthcare. You've probably heard of exoskeletons, but there's much more than that to it as well. There's robotics now being used. We've got social companions for the elderly to really help people with loneliness and to help treat mental health issues as well. Another exciting area, of course, is AI, where we've seen some pretty impressive applications, such as Google's DeepMind, creating an AI for spotting breast cancer that can outperform human radiologists. But there is still work to be done, and it's encouraging to see public health agencies getting involved in the forwarding of technologies. The National Health Service for England, for example, has also just set out its plan to level up digital maturity after identifying a whole lot of areas that require improvement, and commits to rapidly and consistently adopting new models of care that exploit the full potential of digital technologies. And these ambitious plans include £200 million being made available to further develop virtual wards, which utilise remote monitoring technology to treat patients at home who would otherwise need hospital treatment. So the question for you is, regardless of your industry, what do you need to read, learn, retrain, and ask about, commit to? Information and training has never been more accessible, so get amongst it. It's up to you. And if you're seeking an executive role in marketing, sales, or operations in the fabulous health, fitness, and wellness sector, please reach out for a chat. We can help you make that transition. Upload here for more.